the News Channel 5 network, this is MorningLine with Nick Barris.
Good morning, everyone. Thanks for joining us on Morning Line. Nick Barris here on a Monday. I hope you had a nice weekend here in the Middle Tennessee area or wherever else you are watching us, and especially that your mother. If you had time to spend with your mother on Mother's Day, I hope everyone had a great one. It was beautiful. And I'm hearing from more people on Facebook telling me, what it was they did and had a great time. And so I hope that was had by all. And we're back at it on this Monday. I'm here at the News Channel 5 studios. Again, continue to come down on a day when the city of Nashville is about to enter into phase 1 of the reopening. And I know a lot of people looking very forward to that, of getting back to work, as much of the rest of the state is slowly doing so with safety still in mind, but reopening and letting people, I think, get back to work and the like. I think a lot of people ready for that. Let's just do it safely. So a lot of elements to COVID-19 that we continue to discuss. And we've got 3 great guests joining us throughout the show today. And as always, I'll invite you to join in the conversation. We'll put the phone number up in a moment, and we will take your phone calls here on the plus, 737-7587. Also, as we've been doing throughout much of this pandemic, we continue to stream MorningLine and other programs, but MorningLine live on Facebook, and that's at newschannel5.com Facebook. I'm checking on it now. I see folks right now joining us. You're welcome to message us as we go. We're going to start things off this morning with our first guest talking about the latest. As things are reopening and safety is in place, what's happening? And we've seen a lot of stories on this inside our prisons and jails. And is enough being done to make sure that COVID doesn't spread? The idea of maybe releasing some of the non-violent offenders early so you don't have overcrowding there. To talk about that, we are joined this morning by State Senator Brenda Gilmore. And can you hear me okay, Senator?
I can. Good morning. How are you?
Good. Good morning to you. And I hope you had a good Mother's Day.
I did. Okay. The weather was so gorgeous. It was absolutely nice. Hard not to have a great day.
I couldn't agree with you more. Well, listen, thank you with us this morning, joining us on this Monday morning. Let's start with you in terms of your concerns at this point. As we've seen, I think we've all seen the stories about some facilities more than others having some real issues with the spread of COVID-19, and the question and how slowly it's happening with the potential for the release of nonviolent offenders to try to ease kind of the crowding in some of these places. What do you think, and how is the state doing with that regard? I guess you're looking primarily at the prisons, but we know there's issues in jails as well. Go ahead, Senator.
Right. I think the state must do more to protect our prisoners and the staff and the inmates. They have announced that they are testing all inmates. I'm very pleased. This is still not enough, though. When we see in Trousdale prison that over 50% of the people that have been tested have shown that they were positive, and in Bledsoe, about a third of the people that have been tested were positive, then those are red flags that the number of inmates that are going to turn out negative is just going to be astronomical, much more than it is in the general population. And this is totally unacceptable when there are steps that can be taken to bring those numbers down.
So specifically, let's get into that. We've heard about the idea of maybe releasing some of the low-risk inmates near the end, perhaps, of their sentence and get going. But specifically, what more do you think needs to be done that you think would make a real difference?
Well, I think that the suggestion that you just made is number one, is those low-risk inmates, those non-violent ones. Most of the people, the majority of the people in prison are for non-violent offenses, and most of them are poor, lack education, and did not have adequate representation. Those, I think, that could be released. I think right now there are about 1,000 people who've been granted parole. And the only thing they need is to fulfill an educational requirement. There's absolutely no reason why those individuals cannot be released immediately. And they could take an online course, or perhaps it even could be waived in these unprecedented times, especially since they've already been granted parole. I think there's an aging population. Most of the time when people commit crime, they're young. In Tennessee, we have some very harsh laws. People stay in prison for a very long time and they age there. So the elderly, those that are particularly vulnerable with chronic diseases like asthma, cancer, diabetes, hypertension, heart disease, cancer, those individuals could be released, I think. Moms who are pregnant, I think they certainly could be released. Individuals who have other underlying conditions could be released. And we could streamline the whole process of probation. It's extremely cumbersome going through the probational process. Those are some of the things that I think that we could do immediately to bring the prison population down, because it's just virtually impossible for the inmates to maintain social distances in prison. And when we see infection rates anywhere from 33% to 50%, then I don't think that we should continue to wait till more inmates die before we take action.
All right, I'm wondering then what you think is slowing things down. Now, I know here in Metro there was the talk of maybe some blanket plan where they would release, and they decided against it, the judges, and they said, we'll look at it case by case. I think the general public out here recognizes these are folks incarcerated, paying their debt to society, but if you're convinced, especially some of them who are just being held right now without bond while they're awaiting trial, if they can be released in nonviolence, I think most of us would agree, as long as they're not a threat to society, let's do that. And I think a lot of the sheriffs and judges would agree. So why is it taking so long? I mean, what you suggest are things they say, yes, I think we can do this, but it doesn't seem to be happening quick enough.
Well, I agree that, again, those nonviolent cases, I'm not in any way suggesting that people who have committed really heinous crimes, that we should release them, open the doors, and just let them out. But those who are in there for drug offenses, first offenses, nonviolent offenses, then I think that we should release them. Now, I know in the case where we have contracts such as core civics, I think, my personal opinion is, and I will submit this, that the only reason that we're not has to do with the fact that we're just making money off of these prisoners. And it's to the advantage of these contractors to keep the prisons filled. Again, most southern states, including Tennessee, have extremely harsh laws. People get an enormous amount of time, sometimes for first-time offenses. And so, therefore, it creates overcrowding of our jails as well as our prisons.
So what can you suggest from the legislative level now? I mean, is there something that can be discussed? I mean, time is of essence. That's the problem here, okay? And we're moving forward with reopening in a lot of areas. So what more can be done from your perspective as a state senator?
Well, I know our governor has, that is one of his pillars, was reforming criminal justice reform. However, we just have not seen it play out in the legislature so far. We've not seen any real action take place. We've kind of nibbled at the edges, but I don't think it's had real impact on bringing those prison numbers down. Across the country, though, there is a trend to have criminal justice reform. So I'm hopeful. It's the only thing with this pandemic, I think it's hurried up. There's a need for us to hurry up and do that, and to just try to be creative and show compassion. We're in a Bible Belt, Nick, here, and so we should have compassion and be willing to give people a second chance, again, for those nonviolent offenses.
You know, one part of it we're discussing right now, the inmates and the nonviolent offenders, but I mean, what about the correctional officers, the guards? I mean, I think about them as well, being in this environment where maybe several people are getting sick and it's so crowded, and they're part of that as well. I mean, have you considered that aspect?
Yes, absolutely. The staff and the prison guards put themselves in harm's way every single day. They are considered as what essential workers, and they go in Trousdale when over 2,000 inmates are there, and about 1,300 of them were infected and tested positive for this virus, and over 50 staff members and guards also tested negative. That means that they take those viruses back to their families and back to their communities, and it's just a snowball effect of continuing to carry this virus from person to person. Yes, I'm very concerned about the prison. I'm concerned about the prisoners. I'm concerned about the staff and the prison guards there. We need to do everything that we can to protect them. They're putting their lives on the line for us.
Absolutely. Some of the frontline workers in this pandemic. Listen, Senator, we thank you very much for coming on. It's something important to talk about. You're right. They're going to hopefully be doing more testing, get up at that and running. And we'll see if district attorneys around the state start taking a closer look and hear what you're saying and others about maybe let's move forward and try to thin out some of the folks being held behind bars who can be released safely. Thank you very much, Senator Gilmore, for joining us this morning.
Thank you for having me on. I appreciate it. Have a great day now.
It is a pleasure, ma'am. You take care. Listen, we will take a break. That's one aspect of things. It was good to hear from State Senator. Next, we'll hear from State Representative Mike Stewart. He's got some thoughts and opinions on the concept right now that really is key as we reopen things in the state is the contact tracing, to target areas that are hot spots as we open to keep people safe and make sure we continue to follow where there are cases that emerge and take steps to keep that contained so that we can continue to open things up and move forward, which is what I think all of us want, just to do it safely. So we'll take a break. If you have a question or a comment, you can call in. We'll try to get to some of those before the end of the show. We're also streaming live on Facebook and at newschannel5.com. Follow along there. As I said, we'll try to get to some of your comments and just follow along with us, listen as well as we continue. Next up, Representative Mike Stewart and contact tracing, what that is and how that's working right after this.